My name is Tom Wynn. I'm the Chief of Cardiothoracic Surgery at the University of California, San Francisco. I'm joined here by Dr. Marco Di Eusanio from Ancona, Italy. He's a chief and professor at Lancisi Cardiovascular Center in the Polytechnic University of Monarch. About a year and a half ago, Dr. Di Eusanio spearheaded a fantastic meeting from Ancona, Italy in the middle of the COVID pandemic. Focused on minimally invasive approaches to cardiothoracic surgery. In this meeting, there are 3,600 device connects from 79 countries around the globe. I wanted to talk today about the upcoming meeting. Dr. Marco, please give me some background on this upcoming meeting that you're planning.
Yeah, hi, Tom. Yeah, the idea that is behind this meeting is that of giving support to those who want to start or to know more or enforce their minimal invasive and transcatheter cardiac surgery programs. I think we always hear about one trend that we have not to miss, that we have to catch, and that is catheter-based therapies in cardiac surgery. But I also think there is a second trend that we have to catch, and that is minimal invasive cardiac surgery. I think that as a cardiac surgical community, we are ready to have new perspective and have new visions, and that perspective is the patient's perspective. I think we have to be focused and target perioperative quality of life, fast recovery after our cardiac surgical intervention. And there is no doubt that minimal invasive and transcatheter approaches represent the way to go.
Thank you, Marco. I would actually argue maybe the first train should have been minimally invasive, and the second train, the transcatheter approaches, because that's something that's very close to both of our hearts. Can you tell me a little bit more about the dates of the meeting? And is the meeting going to be in person or is it going to be virtual?
This is going to be virtual, like last year. This is going to be presenting together with CTSNet, and it's going to be on June the 7th and 8th. We're going to cover three topics. One is coronary artery disease. The other one is aortic aneurysms, and the last and the second day, mitral valve pathologies. And I also like to highlight the fact that this won't be a very practical meeting. So we will have a lot of videos, a lot of live in the box, showing techniques in details, step by step, and trying to enhance interactivity with the audience. We're going to put one against the other. So we will have different approaches, and the participants, the viewers, will have to choose and vote their favorite. So I think it's going to be fun as well. So this is from my side a very warm invitation to participate and be with us in those 2 days.
And what's also very special is, the audience will have obviously the opportunity to participate in the meeting from the comfort of their own home and interact with faculty from around the globe. So so that will be hopefully a very a great educational experience.
Yeah, but, if I can add that this is going to be also a very direct participation, because this year we are welcoming video abstracts from outside. So please, you can have all the information on the CTSNet website. You can look for us, and you can submit your minimally invasive or transcatheter cardiac surgical intervention and be with us and be part of our faculty. That would be great, I think.
Well, as you know, minimally invasive and transcatheter therapies are something very close to my heart and close to your heart as well. We are both determined to try to educate and disseminate this new technology as much as possible. I applaud you for hosting this meeting. The first meeting was tough because it was in the middle of COVID, but despite that, you had an incredible turnout. I anticipate the same this time around as well. I want to thank CTSNet for hosting this meeting. Marco, do you have any final closing comments for our audience?
Well, we're preparing for a nice meeting. We're working hard. We're working on the layout. It's going to be extremely interactive and probably something different from what we are used to. That's my hope, at least. We're working on that. So we are ready. We are ready. We wait for you to be with us. Please come.
Thank you. Please come join us in Ancona, Italy.
Thank you very much.